Morning everybody, welcome to this meeting of the Overview and Scrutiny Management Board. My name is Councillor Robert Parker and I'm the Chair of the Board. I'd like to welcome all members and officers in attendance today. In particular, I'd like to welcome Councillor Mike Brooks. Mike, attending his first meeting as a new member of the Board. The video feed of this meeting is being broadcast live via the County Council website, and I'd like to welcome members of the press and public who are watching our meeting online today. I'd also like to welcome the following Executive Councillors and Executive Support Councillors who are attending today. Councillor Mrs Patricia Bradwell, Deputy Leader of the Council, Councillor Richard Boothroyd, Executive Council of People Management, Legal and Corporate, and Councillor Sue Woolley, Executive Councillor of NHS Liaison, Community Engagement, Registrars and Coroners. Okay. I'd also like to welcome the following members of the corporate leadership team who are present. Andrew Crookham, Executive Director Resources, Heather Sandy, Executive Director Children's Services, and she's joining our meeting via Teams for item 7, and Andy Gutherson, who's Executive Director for Place. He's joining us via Teams also for item 7. As usual, I'd like to begin with a health and safety announcement. There is no fire drill planned this morning, so in the event of the fire alarm sounding, we need to leave through the doors behind you and leave the building through the reception into the front car park as usual. Can I remind everyone to ensure their mobile and devices are on silent. Also, when invited to speak, can you please ensure that you switch on your microphone? Otherwise, those attending the meeting via Teams and members of the press and public listening into our meeting online won't be able to hear you. Please be aware that you need to speak directly into the microphones to be heard. If you want to ask a question during the course of the meeting, can you please raise your hand as usual, and Vice Chair Councillor Tom Smith will make a note of those who wish to speak. Thank you. Fine. So if we moved to the agenda, item 1, apologies for absence and replacement members. Emily.
Thank you, Chairman. We've received apologies from Councillors Carrington, Macy, Marfleet and Dilks, and we have Councillor Key as in attendance as a replacement for Councillor Marfleet, and Councillor Baxter in attendance as a replacement for Councillor Dilks. And if I could also please just note apologies from Councillors Hill, Whittington, Spratt, Debbie Barnes and Glenn Garrett. Thank you.
Thank you. So welcome.
Chairman, if I may, it's not an apology, but I've got a dental appointment at 2:15 at Market Deeping, so I need to leave about 1 o'clock.
Okay.
Thank you.
I hope we'll be able to help you by finishing the meeting before
I hope
that.
so too.
Thanks, Nigel. Okay. Particularly welcomes to Andrew Key and Ashley Baxter attending this meeting for the first time. Okay. If we could move to item 2, declarations of councillors' interests. Anybody got an interest to declare? You don't have to declare anything if you've already put it in the relevant declaration on your pecuniary interest form. No? Fine, thank you. Item 3, minutes of the meeting on the 26th of May 2022. As usual, we're here to confirm that the minutes from the last meeting are a correct record. If we could go through page by page. Anybody want to raise any comments on page 5, page 6, page 7, page 8, page 9, page 10, page 11, page 12, page 13, page 14, page 15, page 16 and page 17. If there are no comments, do I have a proposer and a seconder on the minutes, please? Fine, I'll propose it and Tom's going to second it. We'll now vote, okay? All those in favour, please raise your hand. Those against? Any abstentions?
We weren't present.
Yes, of course. And I think the abstentions won, but that's another story. Thank you. That's agreed the minutes. So we move on to item 4, announcements by a variety of people. First of all, I just want to say that I attended the executive on the 7th of June on behalf of the OSMB board and made comments in relation to the approval to procure contracts for temporary agency staff and the delivery of HR admin and payroll in Exchequer. In relation to the temporary agency staff comments, I highlighted what we talked about, that we thought that more priority needs to be given to reducing the reliance on agency staff, such as through Grow Our Own, and that we would like to see further work carried out on this with a report back to a future meeting of OSMB. I also updated, the executive were updated on the initiative in place to grow our own staff, particularly in relation to children's services. I did highlight to the executive that it was not possible to add any financial clause to contracts requiring staff to stay with the authority after their training was completed. But it was noted that these programmes were highly successful in the county, with generally 100% retention rate. But they do take time, as the training took around 3 years. And I hope that we will get a paper back to the OSMB receiving further information on how we could reduce our agency spend, which currently stands at about £5 million a year. Okay, any executive councillor announcements? Trish? No. Okay, Richard? Sue? Okay, thanks. Any chief officers' announcements? No? Okay, thanks. Right, so item 5, we move to consideration of call-ins. Have we had any call-ins, Emily?
None received, Chairman.
Thank you. Have we had any councillor calls for action? Item 7.
None received, Chairman.
None. Okay, thank you. So we move to the first main item of the day, Corporate Plan Success Framework 2021-2, Quarter 4. Caroline.
Thank you, Chairman. Page 19 of your pack is the start of the performance report, which outlines Quarter 4 performance in relation to the corporate plan. Overall progress against the corporate plan priorities and our 4 ambitions is predominantly progressing well. You'll recall from previous reports that there are 2 ways that we measure the success of the corporate plan. One is by the activities, so key activities that underpin the priorities and how we want, how we deliver the corporate plan. And secondly, via key performance indicators, obviously where we specifically measure performance against a target or ambition that has been set. Of the 39 activities that we can report in Quarter 4, 34 of them, so 87%, are progressing as planned, which is really positive to report, given obviously some of the challenges over the last 12 months. There are 4 activities where within that activity a milestone has been rated as RAG rated as amber, which means that within that activity an element of the activity, not necessarily the overall activity, is slightly behind where we would want it to be. And I'll just detail which ones they are for you. So within creating thriving environments, we have activity A28, which is around stimulating economic growth through the development of business premises across the county and through delivering the economic capital programme with our partners. And this specifically relates to a short delay around the delivery of a cluster hub building on the South Lincolnshire Food Enterprise Zone, which should have been completed by March 2022, so the end of this financial year, but actually we're scheduled to hand over in early July. So a little bit behind plan in terms of that activity. A34 is the second activity that's been RAG rated as amber, which is around continuing to work with our partners to enhance our community safety. And this specific milestone relates to the Safer Lincolnshire partnership, which was undertaking a health check and relooking at its structure. Again, that was due to complete in March 2022, but actually will be fully complete by September. And most of the activity is well underway, and specifically wanted to mention that the recommissioning of the new domestic abuse outreach service does continue within the agreed timescales. So again, just slightly behind plan on that one. The third activity is within Provide Good Value Council Services, and this is in relation to A35, which will focus on the implementation of our digital blueprint and customer service strategy. Again, specifically, this milestone relates to the Customer Strategy Action Plan, and whilst the plan is progressing well, it is slightly outside of the original timescales that were set. And then the final activity is A43, which is around our attracting talented people through the implementation of our improved recruitment processes. And this milestone specifically related to reviewing and evaluating initiatives as part of our people strategy. Again, due to obviously issues in terms of the workforce, we focused that around our attraction and retention framework in order to try and stabilise and develop the workforce. So not all of those processes have been reviewed, but certainly progressing forward on other elements of that. So they are the 4 activities. There is one activity that has been RAG rated as red, so it's not progressing as we had planned, and that is within Create Thriving Environments. And this is around activity A23, which is around improving utility infrastructure in order to enhance growth through exploring and implementing plans to maximise the development of energy, water and sewage and digital infrastructure. And this specifically relates to an interim report around our energy options analysis study. So a key line of inquiry report was due to be delivered, and due to no suitable submissions from businesses to carry out the work, we had to go and seek a supplier directly. So this did delay the start of this work, but that is now is progressing. A full list of all the activities and all the statuses are available obviously within the report, within Appendix A, and also on the council website. In terms of the key performance indicators, there's actually 9 measures that we can report within Q4 where we've set a target, and of those we've actually got 8 measures of the 9 that are either exceeding the target or achieving their target, which given the last 12 months again is extremely positive. I would like to point out that the targets, have not been adjusted in relation to sort of COVID particularly, although I'll come on to one where we have made a particular change. So those that are exceeding the target, we have percentage of pupils in good or outstanding schools. We also have percentage of pupils achieving grades 5 or above in English and Maths at GCSE, and also the percentage of children in care living in a family environment. I just wanted to point out specifically around the GCSE measure, you'll note that this data relates to summer 2021, where young people were teacher assessed for their grades. It is anticipated that we will see a reduction in some of this in this performance for 2022 when that data is released, obviously as young people sit examinations for the first time in the last 2 years. But positive in terms of those young people achieving those grades. In terms of the KPIs where they've achieved their target, the percentage of schools that are judged good or outstanding, the percentage of 16 and 17-year-olds not in education and employment, and specifically wanted to make mention of PI 32, which is the percentage of superfast broadband coverage in residential business premises. Committee will remember that in the last report that was actually underperforming, it wasn't achieving its target, and it's positive to report that actually that is now within the target that has been set, and this is a really positive output and is predominantly because of upgrades that we've seen in the south of the county and also the easing of the semiconductor shortage. The other measure I was specifically wanting to point out in terms of those that have achieved their target is the rate of children in care per 10,000 population. We have made an adjustment to this target. You'll remember from previous discussions that nationally, obviously we've seen a rise in the number of children in care partly as a result of COVID in terms of being able to exit children from care effectively, but also because of the National Transfer Scheme. So previously we had a target of 46 children per 10,000 population. We have now, with agreement with the portfolio holder, risen this to 50, hence why we are now within our target. And also, good point to note that we're still performing well around the percentage of people who remain home after 91 days after the discharge from hospital. Again, given the backdrop of the pressures around adult care and the reopenment service, I think this is a really positive to see that we're able to keep people within their own homes. There is one measure where we're not meeting the ambition that we have set, which is around our days lost to sickness absence. Q3 we stood at 8.01 days. We do have a quarter lag around this measure, so it's Q3 data. It is a rolling 12-month measure, so it does take account of the whole year, so seasonal variations are taken, are ironed out in that. Obviously, we have started to see an increase in some of those cold and flu viruses, obviously as people go back into the working environment, along with obviously COVID-19 continue to have some absence. And we also see that mental health related absences are higher than our desirable levels, and we continue to support staff with a really robust mental health support offer. So that's the one measure. Chairman, when we met at the pre-meeting, you asked me to look at whether we had sickness absence levels for agency workers. We don't actually hold that data, obviously that's held with the agency. So that isn't something that we can easily report on. We'd have to go to each of the individual agencies and ask around their absence. But obviously if they are absent, then we don't pay for obviously the days that they don't work for us. The second type of measure you'll remember from the Q3 report was that we have key performance indicators where we are reporting them to you but with no target. And we've asked the executive director to give a rating as to whether they believe that we're performing well or whether we believe there's an area of concern. So we're calling those contextual measures. And the ones that have been identified as performing well, PI6, which is the ratio of business births to death. Again, there is a lag on this data, but we're seeing really positive figures coming through in terms of the number of business startups, and we're really starting to see a more stable period, obviously after a high level of volatility in 2021 and 2020 and 2021. We continue to see really positive numbers of people visiting our heritage attractions. We continue to see quarter on quarter that we are performing above the national average, and we have a full summer programme of events planned, and we're really expecting to see those figures continue to rise over 22-23. Our employment level our unemployment level saw a large reduction between September and December of 19%. So our unemployment is significantly lower than the national rate, being driven by obviously a strong labour market and increased economic activities. There is an amendment to the narrative. It does state that around unemployment for those with a disability, we are showing a figure of 9%, and it says it's that it's above the national average. Sorry, it says it's below, and it should say it's above. But just to say that 9% is based on a survey, and a sample size is quite small, so it just needs to be treated with a little bit of caution. We continue to see strong levels of high levels of recycling in terms of our waste and recycling. And in terms of our HR, whilst we're seeing the percentage of staff who voluntarily leave the council, it is stable between 8 and 10%. That's within kind of a healthy turnover. There are some, although that's performing, in line, there are some areas where we've got pockets, as you would imagine, of where we're experiencing higher levels of turnover, particularly in children's social care, legal services, and IMT. And we're obviously working through our people strategy to look at how we can retain those staff. And then finally, the one measure where we are working hard to try and see an improvement in performance is around our complaints. We are continuing to see the number of, as we call, contacts, obviously, that we receive increase. We're also seeing a decrease in our ability to resolve those early. So we are really putting a focus on building capacity within the team to be able to respond, for services to be able to respond to complaints quickly, and that we see an early resolution, and really putting a focus back on that as a key priority. We're working with services to remind them of that they need to prioritise that early resolution. All the details of the activities and key performance indicators are obviously on the council website. And then I'll just finally draw your attention to page 55, which is the corporate plan success framework for next year, so for 22-23, and we will be seeking approval at executive for the KPIs and their targets, which have been agreed by all of the portfolio holders, and along with all the activities that we will be reporting in 22-23. And although some of the targets do say they haven't, at the time of obviously submitting, hadn't been signed off, they have now all been agreed with lead members, portfolio members. I'll now hand over for any questions.
That's fine, thank you. Yeah, lots of good stuff here. We do performing well in lots of areas. We're a scrutiny committee, so we may want to concentrate on where we're not performing so well. But anybody want to ask any questions? Jackie.
Thank you, Chairman. Thank you for that very, very interesting report, and thank you so much for all the good work that's going on. Now, I'm going to kind of challenge you on something, so it's not an attack. It's a genuine challenge which I've been going on about for ages. This measure, enabling everyone to enjoy life to the full. I really am concerned about this measure being in there because we quite simply can't do that. What is this council doing to see that I'm enjoying my life to the full? The answer is you can't, because you don't know what my life is. Now, I'm aware that in the paper it's dealing with the various vulnerable sections of society, the children and other vulnerable people, and that you are achieving on, I think it was 7 measures I read. So I can see what you're doing and that you are moving forward, but that's not what it says. What it is saying is that Lincolnshire County Council is going to enable everyone in the county to achieve a particular emotion. And I do worry that when we're putting this type of measure in, A, it's not achievable if we take it as written. And I think you've got to be careful not to word something which potentially then creates a negative, because the work that's being done is phenomenal. And I really like the way the report is very accessible, so thank you for that. But I do feel, and I mean, I fought this particular measure right the way through and never got anywhere. It kept going through from stage to stage when this was being developed. But I think if I were being really mean here, I would say, okay, can you show me, please, how you are enabling everybody in this room to enjoy life to the full? Because I can tell you that a lot of my residents are telling me that they are not enjoying life to the full. We would have to interfere in their marriages, in their schooling, in their jobs, their income's not enough. We can't achieve it. So I would just, again, for the 100th time, put in the caution that when we're putting targets like this, we should be very, very careful about the carrier language. But that does not diminish the work that you're doing. Thank you.
Yeah, I suppose I've got 2 comments. First, Jackie, in the nicest possible way, don't shoot the messenger. Okay, and secondly, the answer really lies in partly in your own hands, because these are, as Caroline has said and you've said, issues that the council has identified as being part of its core strategy to make life good for people in Lincolnshire. So you probably talked to one of your senior members on the Conservative group.
No, Chairman, could I come back very briefly?
Of course.
It is, look, when we're doing public-facing reports, we need to say what we mean. Okay, absolutely not shooting her. She knows that, I think. But you do need to say what you mean, because, you know, why introduce potential for challenge if there's none needed? I'm very pedantic about carrier language, and I know I'm a pain about it at times. But it's just a caution, which I'm going to raise every time I see it anywhere. So apologies for that. Okay, thank you.
Rob, could I just come in?
Of course you can, Trish.
As a senior member of this council, I think you fair point back to Jackie. I've not heard it raised, so I think I will raise that with the leader and that. But I think when these, what I would say was, when we put together these objectives, we wanted to actually get, I suppose it's all about getting people to aspire to things, and actually we're not going to change everybody's life in Lincolnshire, but there are some people's lives from our services that we do change in an enormous way. So I suppose you're right, it is only looking at a percentage of the population, but I mean, even if you look at adult care, you know, actually then people going to a day centre and that, you are changing the way that they live because they're interacting more with people and that. So it's not for everybody, but it is for people who, not like you and I, who have a friendship group, you know, we've got family and that. There are people in this county who haven't got those things, and that's where we would expect to be able to make things better. But I do agree with you. Words, I don't know how we change the words, but it wouldn't be for everybody, because the majority of people in the county will have hobbies, they will go out and that, but there is a big cohort of people who don't do that, and those would be the ones we're focusing on.
Thanks for that. Councillor Key, Andrew.
Yeah, thank you, Mr. Chairman. My question relates to mental illness absences amongst staff. And I wonder, this has maybe been discussed before, but did that get worse during the COVID when everybody was working at home? If it did, and people are now coming in, what more can we do to encourage a team building type thing with people coming and going all the time? And I'm sure that doesn't help people's mental illness if they're used to being in an environment with lots of other people. Thank you.
Thank you, Joe. I'll come in on that one. So it has come up in previous meetings when we've been talking about the people strategy and the HRMI quarterly reports that we take through. There has been an increase in mental health issues, as I think as Caroline referred to in her preamble, in terms of presenting the report, and as she also referred to plenty of the other the measures that we're putting in place, particularly through our sort of health and wellbeing networks within the staff networks that we support, particularly through the public health team and through the human resources function. One of the key thrusts of the smarter working policy that we've got in place in terms of this hybrid way of working is around ensuring that we maximise bringing teams together to ensure that those support networks from your colleagues are in place, that we really are majoring on bringing teams together to ensure that, absolutely people are being supported, and particularly new starters as well, as Councillor Key referred to in his question. Really important that we bring particularly people who haven't been working in local government before, and the ways we do things and what have you, really clear to provide those people with the right sort of support as they come into the organisation, and so that they can thrive in their career with us. So very much high on our agenda. Thank you.
Yeah, Ashley.
Thank you, Chair. This is an interesting meeting. I've not been to one of these before. Very good. First of all, I would disagree with Councillor Brockway in that this thing about enjoying life to the full is an aspiration, or rather an ambition, not a target. And the ambition above the one about living life to the full is support high aspirations. Well, that's just as woolly as living life to the full. I might aspire to be an Olympic gold medalist. What's the county council going to help me with that? Or I might aspire to get rich or get beautiful or famous, but it's equally nebulous. So yeah, either we look at all of them and think, well, it's just a woolly aspiration in itself to have these ambitions, or we look at it for what it is, which is a title to include a bunch of proper targets and performance indicators underneath. So I haven't personally got a problem with it. I have got a problem with performance indicators 36 to 39, which are on page 34, the recycling. We say that we divert most of our waste from landfill. I still think, and I still believe, it's better to recycle than it is to send to we don't call it incineration, do we? To send to energy from waste. But I can't see within the report what the recycling rates are. I could do it with a calculator, but it looks to me like our actual recycling rate is falling. Can someone verify that? And if so, is there an explanation as to why our recycling rates are falling? On report...
Just pause there for a moment.
Yes, yeah.
Caroline, can you help on that?
Yeah, I'd have to have a look into it. I don't know if Andy's on the call or not, whether he's joined, whether he can comment on that.
Andy?
Morning, everyone. Can you hear me all right?
Certainly can. Thanks. You
Okay,
heard the question.
I did hear the question, yeah.
Fine. Can you deal with it?
Yeah, so to some extent, Councillor Baxter, you're right. The headline figures do indicate that the recycling rates are falling. That is something which is a concern. I think, not to be sort of disingenuous about it, it is a reflection on the events of the last couple of years where people have perhaps been more at home, and therefore their approach to managing their waste has changed a little bit. But as you know, we've got the rollout of the card and paper collections that are now in place across 3 of our districts. That is already bringing benefits in the context of those areas are showing an upturn in the recycling, and it's also bringing benefits in terms of the quality of the recyclates that we're actually getting. We collectively across the county with our districts as the waste collection authorities can't be complacent about it, and we do need to continue to push and look at other initiatives to ensure that recycling, dare I say reuse recycling, are priorities ahead of actually putting waste through the energy from waste plant. The Environment Act will bring further expectations and responsibilities on us as the disposal authority and the districts as collection authorities in terms of how we actually dispose of other elements of our waste, notably food waste. At this moment in time, I can't give you any greater clarity because we're still waiting for confirmation of revised legislation and guidance that will come out of government, but we'll continue to keep the Environment and Economy Scrutiny Committee advised of those developments.
Okay, fine. Thank you. Ashley, do you want to come back?
Yes, please. It would be helpful at 4.5.2 on the left-hand side graph. This is on page 34. On the left-hand side, which is absolute weight, so kilograms, we have identified the recycling, but on the right-hand side, for some reason, we haven't. If the percentage waste chart also included percentage of recycling as well as percentage of landfill, then I think that would be better for us to look at, but also easier to interrogate. And I wonder, is it possible to do that? But also, is it possible to interrogate it further? Is there a way that I can look on the council's website and see how much paper, how much card, how much food waste, whatever? I wouldn't want it in every report. The headline recycling figure would be enough. But is it possible to drill down like that?
Again, we can look into the presentation of the information to make this report more effective for members. And what I can also ask is for that to be something that is part and parcel of how we report more effectively into the Environment and Economy Scrutiny Committee as well.
Fine. Okay, carry on, but be quick if you don't mind.
Thank you. Leaving recycling behind, in the paragraph A23, which is the one that where we haven't hit, where we've got the red rag, it says that we have now got someone who's going to deliver what we've asked for. It's not clear to me, have we asked for a report to be written, or have we asked for some infrastructure thing to be done? I don't understand it. And equally on number A35, it says within the report that whatever it is we're expecting to be delivered will be delivered at the end of May or early June. So we're now at the end of June. I understand the report was written before the meeting, but whatever it was we were expecting at the beginning of June, is that now arrived?
Okay, can you answer that, Caroline?
Caroline, do you want me to answer that?
Over to you, Andy.
Yeah. So as Caroline indicated in her presentation, The handover for the building is now scheduled for early July, and that is a consequence of those missing items having been delivered. Unfortunately, we've been a victim of supply chain sort of challenges in relation to sort of post-COVID issues. But at this moment in time, the latest information I've got is that the building will progress to handover in the next month because all those items have been addressed and dealt with. In terms of your first query about the item in terms of the infrastructure, no, this is a report to help establish our evidence base and our understanding of the infrastructure requirements, not actually somebody physically delivering work. Again, a reflection on challenges that exist in the wider marketplace, that there are potentially less people out there capable or willing to do the work, and we had to find a single provider route to procure that work rather than the procurement process that we'd originally followed. We have found that in other areas that, again, procuring people to do some of the elements of the work in our directorate is proving more and more challenging. We need to sort of reflect on that in terms of the timelines that we put in place in respect of project activity, so that we don't end up reporting red against timelines in the future.
Okay, any more questions? Sorry, Councillor? Yeah, Councillor Key again.
Yes, thank you, Mr. Chairman. We've moved on a bit now, but it was just to support what Andy said about recycling, because I live in North Kesteven, who have got their purple bins, and the first week we got them, I tipped all mine out to make sure it had the right things in, and it didn't, because I didn't want to be one of the people who didn't get it emptied. And my point is, it does make you think more about what goes in what bin. So I think he's quite right. As that's rolled out, hopefully the recycling rates will improve. Thank you.
Yeah, Tom.
Thank you, Chairman. A couple of points, as I said to you, Chairman. Firstly, on broadband, whilst I note the work that's been done and I don't decry that, we need to be very conscious of the areas that haven't had improvements. I can name numerous parts of my division. I'm sure colleagues have others that spring to mind, especially when the government are seeking to move to ultra and gigabit broadband, and there are areas in Lincolnshire that don't even have super fast broadband. These communities are going to feel even more left behind very shortly, and we need to be aware of that and do with BT and other providers what we can to address that. On the issue of mental health, do we have, and the reason I ask about gender breakdown is it predominantly in our male members of staff, our female members of staff, because traditionally for men it is a taboo subject, it is not something you broach with, whether it be medical colleagues or even with friends, it's something that you don't tend to broach. Further on the disabled people and unemployment, you rightly highlighted the issue around the sample size. I'd urge further caution, because a great number of disabled people actually won't claim the benefits that you allude to, that's how they are in that sample size, because actually the process of doing so is actually quite onerous and can be quite traumatic. And if they don't have to, then they won't. They will find other means of being able to survive. So there will be a number that aren't claiming what they're entitled to, so they won't be in that report. And I can attest to myself with PIP chairman having gone through that process. It is not a pleasant process. Never mind other types of benefit I can imagine are just as difficult and stressful on the individuals and their families and those that support them to claim. The report also mentions an ombudsman's decision. The exact paragraph eludes me. Is it possible to have a copy of that document for interest, just to see what that alludes to as well? Thank you, Chairman.
Okay, Caroline.
Yeah, I'll certainly look into getting a copy of that.
Okay, yep. Mike, Councillor Brooks.
Thank you, Chairman. I'm looking at the PI 43, the total number of contacts received, and highways and transport is mentioned in there as receiving a high level of complaints, and we've got the Q4 performance on our next agenda in a couple of weeks' time. But I just want, it says that there was a decrease in the number of complaints resolved early across the services. Do we know in which services that decrease has taken place? Is it sort of pertinent to only one service area, or the two that are mentioned, please?
Can you take that, Caroline?
I will, if that's okay, Chairman. Yeah, so we have just reported the complaints annual report to the Audit Committee, and you're right to point out, Councillor Brooks. Yeah, we have focused since bringing the complaints team back in house on early intervention measures and trying to cut challenging complaints off at the pass. There has been an increase in the ability to resolve those complaints at that early pass in recent times, but it isn't specific to any one area from memory. I can provide a bit more detail to the councillor after the meeting if that would be helpful, to aid his management of his next committee in highways. But we are reviewing the way we manage the complaints process continually. We are going to supplement that team with some short-term support in terms of allowing an improvement in that early intervention approach that I talked about. So hopefully we'll be able to report more on that in future meetings and future reports back to the Audit Committee as well, who's responsible for that area. So.
Okay, Mike, I think you want to come back.
Yeah, thank you for that. I just wanted to mention, I have got the advanced papers for the next Highways and Transport Scrutiny Committee, so I do know that there were 163 complaints received in that quarter, and 1.23% of the cases was escalated. But it said none of the whilst cases have escalated to the LGO, none of these have been seen to fault found in either the way in which the service was delivered or the responses provided to the individuals raising the complaints. So there was no findings against the council by the LGO on that. So I think there is it sounds as though there is a good effort going into trying to resolve these cases early. Thank you, Chairman.
Sorry, that's noted. Thank you. Anybody else want to speak? Okay, can I ask a question then? Okay, if we look at the bottom of page 27, which relates to the proportion of pupils in good or outstanding schools, although there was an improvement by 1% to 83.4%, that still left 16.6% of our children in Lincolnshire schools not in a good or outstanding school. Can anybody tell me about what the action plan might be to change that? Trish?
I know Heather's on, she might come in as well, but I think some of the issue we have in Lincolnshire is that we've got we have the LAT, which is it's an academy which is run by the education religious I can't remember what they call it. It's the education religious education. I can't remember what. Jack, help me.
It's the Anglican
anyway,
Trust.
so it's run by the Church of England, and it's so we've got lots of academies in that schools in that academy, and what's happened is I've brought this up with ministers about actually some of our small schools, some of our secondary schools being in this academy trust. We can't do anything about it. They won't work with us. And actually, it is obviously got the bishop and all that supporting this trust, and it is a real problem to us because actually we know with academy trusts, our thriving schools that are in trusts like LSST, and we've got quite a number of good trusts across the county, we have no problem, but we've got lots of our small primary schools in this trust, and we've got a few secondary schools, and they're just not getting the support, and that's what is required. Now, as I say, this has been brought up quite high up, but because it is run by the Church of England, then we're a bit stuck. And so therefore, in a lot of occasions, we, as a local authority, we still support schools, but we can't support them in the way that we have before because we no longer get a grant for school improvement. actually academy trusts and that get that. So we haven't got the money to be able to go out and, like we had when we had CFBT here, we were in schools all the time, schools that we knew were on the trajectory of sort of failing pupils, but we no longer can do all that work. But we have got a group of small schools in this trust that, you know, won't improve and aren't putting the school improvement that's needed in, because you will know, you've been on the council a long time, you know, a school starts to slither down, doesn't it? And actually it needs that helping quite early on to actually lift the performance of that school. So that's all I would say, and I'm very sorry, my mind's gone blank.
Sorry, don't worry. Yeah, I do appreciate what you're saying. I'm the chair of governors myself at a local school. But I just want to come back to the 16.6%. Now, are they mainly in primary or secondary? Because it does seem to me, we all say it, don't we, that the start in life as a child gets in the education system determines to a great extent how they're going to go through the system to 16 or 18 or even on to university. So I just wondered if you could share what you think is the profile between primary and secondary.
I think, is Heather one? Yeah, I think Heather wants to jump in and I'll come in after.
Lovely, Heather.
Hi, thank you, Chairman. Just to say that split is fairly even, but I'll get that breakdown and share it with the committee so that you can see it. Obviously, when a secondary school is judged not to be good or outstanding, it's usually got more pupils in it, so that can sway the balance. I think in addition to Councillor Bradwell's points, the other point I would make is that during the pandemic, inspections of schools were paused because of all the pressures on schools and the work that they were doing. And what that's meant is that schools who were not judged to be good or outstanding have had to wait a long time to be re-inspected and to have that judgment changed, which is a challenge for some of them who have improved in that time. And then the other problem, and we have a case linked to, it's the Lincoln Anglican Trust, I think Councillor Bradwell's referring to. We have a case there where a school's been judged not to be inadequate, and the Department for Education then has to look for another sponsor. It's removed from the trust it's in, and the Department for Education can't find another sponsor, and that has been going on for some time now, and means it's a long time before that school can then be improved and then judged to be good or outstanding. In terms of what we're doing about it, Chairman, you know, again, I would echo Councillor Bradwell's comments. Our role with schools has changed significantly over the last few years. We have had our school improvement grant removed, and the council is considering what that means for us in terms of the team of people who were doing that work with schools, and we will need to continue to consider how we respond to some of those changes and that change in relationship with schools. But we continue to be the champion for children, and I completely agree, Chairman, those 13% need to have our advocacy and our championing. We need to be raising those schools with the Regional Schools Commissioner. We need to be making sure that, as well as performing well, schools are inclusive and that they're inclusive of children with SEND and those who've been in receipt of multiple fixed-term exclusions. So we have a big role to play in that area.
Continue this, but on a different note, and this is comparing our schools in Lincolnshire in relation to good and outstanding to the national figure, because it does seem as though, looking at page 29, that we are below not only our statistical neighbours, but significantly below, well, quite a bit below the national figures for good and outstanding schools. Is there any explanation we can give beyond the ones that have been given so far?
Well, I'll just come in for a start, and then Heather will give you the technical thing, but I'm a bit more basic. I mean, I think with Lincolnshire, we have got an awful lot of primary schools. If you look at Leicestershire, I suppose Derbyshire is probably on a par with us, but we are a large rural county, so we have many, many small rural schools, and in percentage-wise. So I would just say that. I think we do very well. I mean, you could pick out other indicators, but I think we do very well with what what we've got. And we've always strived to us, you know, to help our schools whenever we can. But I do think the numbers of small schools, and they can be 50 or less pupils in them, is very difficult because you have to have an infant and a junior classes. You know, and sometimes if you've only got about 40 children or something like that, it's very difficult. You've got to pay 2 teachers, and we all know that schools are funded on the numbers of bums on seats. So it is very difficult in a rural area, and I'm not making excuses at all for that, because, you know, a lot of children, they do thrive in a school, but because we've got indicators where we're saying a child has to achieve this at this age, that can be very difficult. We've all had children. I have got one in particular, she was my eldest, who did not thrive at all in primary school. She just was not interested, but yet when she got to secondary school, it probably all clicked. So I think all children are different as well, but I don't know whether, Heather, do you want to come back in?
Yes, thank you. Thanks, Councillor Bradwell. Thank you, Chair. The other element that can skew our figures on this is we obviously have selective education in Lincolnshire, but Ofsted apply the same criteria for good and outstanding to every secondary school, regardless of whether they're selective or non-selective, which can mean some of the benchmarking for our non-selective schools to get into that good and outstanding category can be challenging when there is a kind of cohort of children at that higher end who are being educated in a school in the same town. And I think that can be a challenge, and if you talk to our secondary heads, that they would raise that as a challenge. I'd also agree with Councillor Bradwell that we're looking at a very specific measure here. There are other measures included in this paper and wider within the council around the performance of children. And we know that the performance of children at our secondary level, our children are leaving secondary education above our stat neighbours and above our regional neighbours. So there are a range of measures, and this one's particularly focusing on the Ofsted judgments, which are a challenge for some of our schools, either because they're very small or because they are non-selective in a selective area.
Fine, thank you. Anybody else want to raise anything? Tom.
Thank you, Chairman. It goes back to what Heather said. I'd be very careful about, yes, you have to be aware of them, but using Ofsted as the only means of measurement in terms of how well our children do in schools or otherwise. I think certainly when I was at school, Lincolnshire also had actually quite a high number of SEND pupils. Now, there will be some who are able to undertake examinations and carry on. They do have their issues, like I did when I was at school, but then there will be those who have a more severe need, who are still go through that process, but actually they're starting from a much lower base, so the mountain they have to climb, if you will, is much higher. So that, although that won't skew the Ofsted figures, that may impact others, but I think it's important that we're aware of these facts. And as Heather said, we have a lot of small primary schools. One in my patch, which is Graspy. In terms of size of primary school, springs to mind. I know that they're a very good school and do very well, but it must be a challenge for them when they're the size of the school and what they're asked to do in terms of inspections, because they seem every time and every year to be ever increasing the demands on what they're asked to do. So I just urge caution in using that as the only benchmark whilst giving it the necessary credence at the same time, Chairman.
A fair point, but it's the only benchmark we've got here in relation to this meeting. Okay, if there's nobody else, fine. If we just go back to actions required, consider the attached report and determine whether the board supports the recommendations the executive has set out. Secondly, agree any additional comments, which we've had plenty of, and review on comment on the performance information that's within the remit of the board, and highlight any recommendations. So I think we've done all those. Is it okay for us to vote in favour of the recommendations? Anybody voting against? Anybody abstaining? No. Thanks for the presentation. Appreciate it. Just before, there's one small thing which I haven't included, but if we look at if one looks later at Appendix 2 and Appendix A and Appendix B, you'll see that the print type is quite a bit larger in relation to Appendix A. And to be honest, Appendix B is in such a small type that it's seriously difficult to read. So I'm just bringing that to your attention for the future.
Especially on a computer, Chairman, it's even harder.
Okay, fine. So we'd like to, wouldn't mind rectifying that at some point. Thank you. Okay, so we now move on to item 8. Question of establishing an integrated care partnership with an integrated care board. Alison.
Thank you, Chairman. I'm here today to ask the board to consider a report which will be presented to the Executive on the 5th of July, asking them to agree to the County Council jointly establishing an integrated care partnership with the Integrated Care Board. The Health and Care Bill received royal assent on the 28th of April. This requires each area in England to establish an integrated care system. The Act comes into effect tomorrow, the 1st of July. So under the Act, each ICS has to establish 2 statutory bodies exercising statutory functions. The first is an Integrated Care Board, which brings together the local NHS organisations, and this is an NHS body which will take over the functions of the clinical commissioning group. So clinical commissioning groups will cease to exist from today and will become integrated care boards as of tomorrow. The second is an integrated care partnership. This is a joint committee of the County Council and the Integrated Care Board, which will have the statutory responsibility to prepare an integrated care strategy. So the County Council has a duty under the Act to establish the Integrated Care Partnership with the Integrated Care Board as part of the ICS arrangements and to provide a representative on that partnership. So the Integrated Care Strategy will need to take account of the Health and Wellbeing Board's joint health and wellbeing strategy and the joint strategic needs assessment. In most ICSs, there will be more than one upper tier authority, each required to maintain their duty to have a health and wellbeing board and to ensure that it continues to fulfil its duties as a committee of that authority. In Lincolnshire, the County Council boundary and the ICS boundary are coterminous, which means that we have one ICP and one health and wellbeing board at a Lincolnshire level, and we'll have one integrated care strategy and one joint health and wellbeing strategy. A planning workshop was held at the end of April with members of the Health and Wellbeing Board and the ICS to discuss how Lincolnshire would operate under this new landscape. Because of the unique position that we find ourselves in, i.e. being coterminous, there is an opportunity and a desire to keep things as simple as possible and to avoid duplication. So wherever possible, the intention is to align the meetings of the Integrated Care Partnership and the Health and Wellbeing Board to try and mirror the membership and to ensure that it's reviewed annually to make sure that it is still aligned as far as possible with the Health and Wellbeing Board, and to appoint an executive councillor as the chair of the Integrated Care Partnership to reflect the approach taken by the Health and Wellbeing Board. There's also an intention to try and align the 2 strategies as far as possible. We are expecting further national guidance on the integrated care strategy to be published in July. And once we've received that, we'll look to make sure that we try and work that so that the integrated care strategy and the joint health and wellbeing strategy are as aligned as possible. The executive is being asked to approve the recommendation to jointly establish the ICP with the Integrated Care Board and to ask for Councillor Woolley to be the County Council's representative on that partnership. So I'm happy to take any questions.
Are there any questions? Yep. Ashley.
Thank you, Chair, and thank you for the report. Who else is on the Integrated Care Partnership, and specifically, are there any other representatives of local authorities on it?
The membership of the ICP is a matter for the ICP once it's established to agree who the members are. But as we're looking to mirror the membership of the Health and Wellbeing Board, there are other councillors from the County Council, and there's also a representative of the district councils that sits on that.
So, through you, Chair, it would be politically balanced?
Yes, I'm being told, yes.
Councillor Woodley, what would you say in relation to the gains that we'll get out of this and the way forward?
I think one of the biggest things is that it's particularly for the public as well, that anything that makes it easier to understand that health and care should be joined at the hip, that particularly residents and patients should understand exactly what they are not just entitled to, but what they can expect as far as support from either our health colleagues or indeed the local authorities is concerned. And this should allow for that clarity. We are very fortunate, as Alison has said. I think we're one of only 4 systems in the country where we're coterminous with the upper tier boundary and of local government and indeed with our NHS colleagues. That makes life so much more so much easier for us to be able to liaise with each other. But what we're intending doing, and obviously over a period of time, it's become more noticeable that particularly with those wider determinants of health, that there is a need to bring on board a wider group of members around the table without it being a conference as opposed to a committee. So our hope and view is that we will include additional membership, which includes a representative from the LEP and indeed from higher education, because again, going back to working with our health colleagues, that ability to be able to grow our own, be in health and care, is a way that I would welcome and want to encourage in Lincolnshire. Happy to take any more questions, Chairman.
Sure. Questions? I've got one, really, which is the aim of it is to bring the NHS together locally to improve population health and care. That's very laudable, really is. But what do you think you'll be doing in a practical sense that we could explain to the ordinary person about how you're going to set about tackling the improvement in health and social care?
I think you're absolutely right, Chairman, that that communication around the clarity is something that's been in this setting. It's been around for ages, trying to explain to people in not quite one syllable words, but what they should expect and hope for. But I think in this particular instance, where I would like to think that our residents will see a difference, is in that earlier preventative arena where we will be working with our public health colleagues and encouraging them to support their health colleagues, because obviously public health sits within the local authority, and the NHS uses a lot of the same information, that we're joining those processes up so that where we see we've got an issue on something, and let's take obesity as an example. Public health hold all the information, but sometimes it ends up being our health colleagues that have to deal with the situations that eventually arise. And so it's that ability to use that information at a much earlier stage that benefits public. So in the long term, we haven't got people ending up having to use resources far too late in the day.
Early intervention is one benefit that could come out of it, maybe.
I would like to think so, yes.
Okay. Yeah, sure, Tom.
Just to clarify, Councillor, am I right in thinking that with the creation of the ICS, this then removes that the ICS becomes one body for the whole of Lincolnshire, so you don't have, as we did, a CCG in the west, a CCG in the east, and actually the CCG in the east wasn't in the east; it also took part of the west, but the west it was totally not to a resident. If you didn't know the difference, you would think, oh, I'm in Market Rasen or Osgoby. Oh, my CCG will be the West CCG. You look it up. Oh, no, I'm in the East CCG for some strange and nonsensical reason. So that's good to know from your nodding of your head that actually we'll have one one body that deals with this for Lincolnshire rather than multiple bodies, because that then means one purse string rather than 4 or 5 different purse strings all doing slightly different things, even though you're all in one county.
Anything to say?
Completely agree with Councillor Smith. When the 4 CCGs were initially set up, I did plead with them to just be one. They did eventually become one Lincolnshire CCG, but as Alison has said, that actually is disbanded today with the ICB coming into effect. But in the short answer to Councillor Smith's question is yes, it should add clarity. I think having said that, I think you've got to be a little bit cautious, because obviously the trusts, and particularly on our geographical edges, for example, where I live in the south of the county, the trust organisations that will provide Lincolnshire residents who live in the south do actually sit in Cambridgeshire, and likewise in the north as well. So little way to go before we've got one trust, and we've got other organisations sitting under one geographical area, but it is a step in the right direction.
Thank you. Anything else anybody wants to raise? Yep, sure. Rob.
Thanks, Chairman. Yes, just following on from Councillor Woolley's remarks, I think one of the big problems with the NHS and social care has been people working in silos for many, many years. And I think if this can bring people together and bring more coordination of service organisation and delivery, I think that'd be welcome. So yes, I'm like Councillor Woolley, I'm keeping my fingers crossed this will actually bring some benefits and not just be an administrative change, because those of us who've been around a number of years will know we started off with health authorities, which were north and south, and then they became one, and then we had trusts. The NHS for the last 40 or 50 years has been in a constant state of reorganisation, and I think if we can have some stability and have some coordination, because professionals in different areas, whether with the county council or with the NHS, very often do work together at a professional level, but it's at the administrative level sometimes there hasn't been the coordination. So hopefully, fingers crossed, this may come out of this new organisation. Thanks, Chairman.
Thank you, but the history of the NHS suggests that this particular format that we've got is not going to be very long lasting, but let's hope that it is. Okay, if there's nobody else who wants to speak or ask a question, what we're expected to do is to consider the report, which we've done, and we've got to vote on whether we support the recommendation to the executive that's set out in item 8 and agree additional comments. Well, Emily's been capturing those. So those in favour of supporting the recommendation to the executive, please indicate. Thank you. Anybody abstaining or voting against? Abstaining first. Voting against? No. Okay, that's carried then. We now move on to item, I think it's 9. No, yeah, 9. Yeah, the big one. Okay, Michelle, review of financial performance for 2021-22. 73 page 73 to 164. So I hope you enjoyed all the reading. Thanks, Michelle, for the report.
Thank you very much, Chairman. So the executive report starts on page 77 of your pack, and this is the report of our financial performance for the financial year that's just finished, so 2021-22. The report sets out the year-end position and explains our variances on our revenue and capital budgets, our delivery of savings, our performance indicators, and our reserves, and it also makes recommendations and proposals on the carry forward of the balances on the revenue and capital budgets. Just for context, although we're seeing an easing of most of the COVID restrictions, the pandemic has continued during last year to reflect in our financial position, particularly around the grants that we've received, and how that's impacted on our business as usual is set out in the report. So our revenue budget had a £13.582 million underspend last year, which is 2.5% of our net budget, and that excludes the schools' balances. The schools had an underspend on their area of 17 million. As that is dedicated to the schools as part of the dedicated schools budget, that will carry forward automatically through our reserves for them to use in future years. Table C on page 85 of the report gives a service breakdown, and paragraphs 118 to 134 provide you with the summary of the detail of the main variances of the service budgets. That's given a bit more detail in the appendices of the report, and predominantly the variances we're reporting are as we have reported during our quarterly reports to Scrutiny and Executive through the year, and featuring areas such as the budgets for children in care, school transport, and the use of one-off grant funding and how that's impacted on our services and budgets. As I mentioned, the COVID grants have continued through 21-22, with us receiving over £62 million of general and specific grants. And the report sets out the kind of key areas of spend there, with total spend being 65 million. The expectation is those grants will not continue into 22-23, so we'll continue to have some pressures, I don't doubt, particularly in children's, and we'll continue to see the impact of that, but the financial support we've received from government is due to end. It has ended in 21-22. The capital position, table D on page 89 sets out the summary of the capital position. The net programme underspent by £50 million in 21-22. The explanations will show you that most of the variances are slippage in delivery rather than underspends, and you'll see the theme on the capital is there are some particular challenges on our capital projects, particularly around inflation and supply chain. Some of the slippages on some of the major projects, so the larger major road schemes have got some slippage in there, with some slippage also on the LEP projects. 11.6 million of that was from uncommitted budget in the capital corporate development line. All capital budgets are carried forward automatically, but we will review the whole programme as part of setting the budget for 23-24 to ensure that current project budgets are adequate and that the programme is affordable. In terms of the carry forward, the table E on page, summarised on page 92, sets out, and that's also in the OSMB covering report. So I mentioned that the service underspend was 13.582 million. The table shows that the 1% that we are allowed to carry forward in each director area takes 4.7 million off that, and we have a couple of business as usual transfers into reserves that are also set out in there, which leaves the balance remaining for consideration of 7.392 million. The proposal that's being made is that 5 million of that is added to the development fund for local highways works. We have done this previously to supplement the highways budgets. As you know, we've had the big campaign to fix our funds, to fix our roads, and we continue to see that as being a priority for the council. So the recommendation is to add 5 million into there to support that work. And also then the balance, then 2.3 million, to be added into our contingency budget, recognising that the inflationary pressures are escalating within the council's budgets, particularly uncertainty around cost of supply, utility supplies and pay inflation. So the recommendation is to put the balance of that 2.3 million into that revenue budget. So that's just a brief summary of the main points in the report, and happy to take any questions.
Yep. Thank you, Michelle. Just for clarity, although I'm chair of the Women's Scrutiny Board, I'm also leader of the Labour Group. So at the full council meeting, I will be speaking on this, and I will be abstaining on the vote in relation to this recommendation that's before us. Okay, that's just for clarity. Fine. Questions? Anybody want to ask anything? Ashley.
Chair, the Vice Chair also had his hand up. I don't mind giving way to him. Oh, thank you. Thank you very much. It's not a question really, it's a comment that back in February, the opposition members proposed a transfer of the relevant funds of a similar number to highways. from the predicted underspend, and we also proposed a transfer to mental health and the Green Master Plan of similar to the second contingency budget, and all the Conservatives voted against. So I'm pleased that we now seem to be recommending a very similar transfer of funds that I recommended back in February, and it's a shame we've had to wait 6 months to do it. Thank you.
Trish, do you want to comment on that? I don't think it's appropriate for an officer to answer that question.
I don't really, but I will just say one thing. We would wait till the end of year to allocate any underspends, because we don't know what's going to happen in the intervening time. So that's all I would say. It's usual that we would make decisions about underspends at the end of the year, when all the we know what the exact situation is. So that's all I'd say. There's lots of pressures across the council. I mean, there's building pressures. We're building special schools, and I wish I was making tarmac or making bricks, because actually the cost of the materials are just going up by the day, and you know, that's across council with tarmac as well. So you know, we don't know that capital budget that we've got. We don't know what's going to happen really, and we are in very uncharted times with that. But it is the usual thing is, as I've just said, is to look at what we've got at the end of the year, which I think is prudent bookkeeping and accounting, and then we make a decision where we want to put the fund in. But I have to say, I'm quite happy it's gone into tarmac now with my local councillor hat on, because I've still got loads of problems on my rural roads, which I still don't think I'll get fixed. Sorry.
You want to come back briefly?
Yes, obviously I've not been to this meeting before. I'm not sure how much influence we have over it, but is it possible to encourage the council to spend some of that, or allocate some of that contingency budget to the Green Master Plan measures, which were relevant before, obviously because of climate change, but even more so now because of the, as the councillor mentions, the ever-increasing costs of utilities, specifically electricity and gas. Surely we should now be ploughing money into schemes which where the life cycle cost of improving energy generation, boiler efficiency, and similar energy and heat saving schemes, we should be ploughing money into that in order that we can reap a saving in the not too distant future.
Okay, and this isn't a ruling, but of course we can make recommendations, but I think that the best way is the fact that you've spoken along the lines you have done will be captured in the minutes, and that will go to the executive on Tuesday. The reason I say that is because I don't think you'd get very much support in this meeting for that sort of recommendation, but you can try. Eddie.
Thank you, Chairman. I'd like to agree with Councillor Bradwell, absolutely spot on. Councillor Baxter makes the point, but I think the headlines on page 74 and 95, in fact, state balance remaining for consideration. And I think that's important to take into context. And indeed, right underneath it, it says proposed allocation of remaining balance. Obviously, as Tricia mentions, this will be dealt with at a future meeting. I suppose when that future meeting arises, I would be interested that if the £5 million is allocated in the 4 highways areas, is it going to be a straight split? But I know that's not a question for this meeting, having just said what I've said, but when it comes to that decision, if it's still going to be allocated to highways in that form to the 4 areas, because of course, being a councillor for Lincoln, we are the biggest urban area, and therefore we take a lot of pounding as far as the roads are concerned. It'd be interesting to see what that split is come that time, Chairman. So it's more of a comment rather than a question. Thank you.
But like the previous comments, it will be captured and reported to the executive. Okay.
Yeah, thanks, Chairman. Just to come in, just to clarify and provide emphasis to some of the comments that have been made about the process for this report. So clearly, this is a key financial document, and like the budget, it goes to Council for final approval. So additions and withdrawals from reserves cannot be sort of mandated without that process. So there'll be the ability to debate some of the finer points of the proposals that, whatever proposals that the executive choose to submit to council following its meeting on Tuesday to the September council meeting, that will have the opportunity to do that at that point at that meeting then. So hopefully that's clear.
Thank you. Nigel.
Yeah, just a little query, if I may, Chairman, on the table on page 95. The civil parking enforcement and permitting, I'm aware it's a ring-fenced item, but the amount of complaints I get about parking, if there's some excess money splashing around, it would be handy to get some more parking attendants on the road, but I'm sure it's not as simple as that. If someone could explain for me, please.
Noted. And so to what Andrew said, you know, opportunities for discussion at the full council meeting about, or beforehand, privately, with the controlling group. Yeah, Jackie, sorry.
Yeah, Chairman, it's okay. Actually, I'm in a challenging mood today. I'm going to challenge you on something that you've just said. As chair of this committee, your opinion is extremely valuable and is essential to this committee. And I'm concerned that you're withholding your opinion on this because of your political role elsewhere. We're here today as scrutineers, and I think it is... I remember having challenged you on this in previous years, actually, but privately then, I think. I think as chairman, we do need your input and we do need your view. It's likely to be different from ours, and without your view, both we and the public are denied a certain balance. So I would ask you to give your view as chair of this committee. If you then feel you can't vote, I would have to ask you why. But if you feel you can't, I would respect that. But I think we as a committee are entitled to the views of the chairman. Thank you, Chairman.
Thank you for that. Councillor Key.
Yes, thank you, Mr. Chair. I was simply going to say that I really support this extra money for highways, but I've been a councillor for a year, and if I had £1 for every time somebody'd mentioned pothole to me, I'll probably be able to add to that balance quite substantially. So I think it's the main thing that occupies all of us. And as Councillor Bradwell said, my division is similar to hers, I think, that we have a lot of rural roads, and whilst I understand the point about Lincoln, simply because someone lives down a rural road, perhaps with only a dozen other people, shouldn't prevent their road from being maintained. And that's the one thing that really a lot of these small parish councils that I have in my area complain about. Some of them have been waiting for works for many years. I'm glad to see that some of the works are being done, but I know of several that are really desperate to be done, and maybe this money will enable that. So I think that's going to change a lot of people's lives for the better. Thank you.
Sorry, Councillor Brooks, yeah. Mike?
Thank you, Chairman. Councillor Key said much as I was going to say, but being as we're capturing comments, I'd like to say that I do obviously support the £5 million going into the highways and transport budget, because for going around the four divisions, the four highway divisions. I'd just like to make the point that there are many more miles of rural roads than there are urban in Lincoln. So, you know, that you can argue both ways. So I think you have to, I needed to make that point, and I think Councillor Key was making that point as well. We've got many, many, many beat up rural roads, and they've been neglected for a long time, so we need the money there as well.
Thanks. I mean, it's not a question really, is it, of urban versus rural roads? It's urban and rural roads that we want to be looking at, with some sort of priority system, which I'm sure highways have got, for determining which comes first. Who's next? Yeah, Tom.
Thank you, Chairman. As has already been said, as we're capturing comments, I totally support the additional money into highways, as Councillor Brooks said, and Councillor Key. If I had £1 for every time highways is mentioned to me, it is the #1 priority for residents. It's especially important because actually and I'm sure other councillors have had this, I've had a number of residents who have had sustained damage to their vehicles because of very large potholes, and then claims have been sent to the county council. Now, you know, there's obviously the safety aspect of this as well. If that had been somebody on 2 wheels, then things could be a very different conversation. But we also, as a body, don't wish for our residents to have to wait 6 months for claims to be processed after they've had an initial outlay for damage, which is going to be a lot of money. But it also prevents negative press and also costs to us as an authority and others as the taxpayer who are putting out for the costs of claims. So it's vital that the money does go into highways, in my view. I'd just like to touch briefly on a point Councillor Baxter made about gas. The name of the framework escapes me, I apologise, but we are in a framework as the council, so we're in a fortunate position really. For a number of years we can sign up for our gas in advance, which we did do before. Thankfully, things in Ukraine happened before inflation went higher, so at present we are paying less for our gas. It will be an issue when that contract expires, you're quite right, but as the Chairman said, that debate is for another meeting and another time, but I just wanted to make that point, Chairman. Thank you.
Okay, anybody else? Okay, my comment, and thank you, Jackie, for your contribution. Perhaps I put my opening statement rather clumsily. I have got questions to ask, and I suppose the first one, Trish, probably you're the best person to answer it, is what consideration was given to any other items of expenditure in relation to the use of the budget? I know that we've got the budget proposals, how to spend, before us, dominated by highways, but what consideration was given to any other departmental spending?
Well, there is a discussion goes on, but I think everybody on the executive would understand the issues that highways are under. I mean, you know, looking at the balance sheets at the end of the year, most of us have all come in nearly on target and that. I mean, but highways, to be honest, it is a major problem where we are receiving complaints in this council. And we all know, I mean, as you've said, Lincoln, we should look at every area. I know I've made a quip about my area, and I probably shouldn't have been deputy leader, but, you know, we're all members, and I don't know about you in Lincoln, but whenever I've got probably 14 parish councils, and some don't meet that often, but some meet regularly on every month. But you go to any of them, and the major issue that comes up is the state of the roads and footpaths. So I think for members in this room today, you know, that would be something that is a problem, I think, for us as members, and it therefore is a problem for the council. So I think that is why the decision was made, because we want to actually have our residents a little bit more happy about the roads. Now, £5 million, I don't know, if you had Richard Davis here, he'd tell you how much tarmac that would lay on the road. I can't do that. I'm not as intelligent as Richard. I'll admit that with regards to tarmac. But that is the reason why, because we all know as councillors, it's the one big topic that is always on our... I'm always at every meeting asked, when are we going to get this road done? When's this path going to be done? And I know other people might concur with me the same. Now, might not be the same in Lincoln City, I don't know. But I would have thought it was, because all your roads, I have a ride round to go to supermarkets and they're not all perfect.
I suppose it's a general question.
Yeah.
You might be able to answer it and Mike might be able to answer it. But does this seem as though this is a never-ending, what you might call demand, and that we could never manage to find enough out of the budget that we have, except to give it priority and then to use underspends? But it does seem as though this is exponential. Is the need for roads because of the number of roads we've got.
But we're also not I mean, I know we're not funded the same as other rural authorities. Our funding is one of the lowest in the country. If you look at the list of all local authorities, but within this area, we've had £24 million, £12 million taken off us over the last 2 years by government. Well, that was a rural roads grant, and therefore, £12 million is not an insignificant amount. So now we're £24 million down on our budget. So I think, it is, for me, I think, and for my colleagues, this is a major problem for us. And we have lobbied government. The group Richard and the leader went down to see Grant Shapps, and that it hasn't made any difference. We have lobbied quite hard, but we haven't got anywhere. So, obviously having this underspend, actually, we're putting it where we think we should have proper funding from the government. But as I say, it won't be enough to fix the problem this year or probably next year.
Sorry? Yep. Eddie.
I'd like to come back, Chairman. Obviously riled some of my colleagues here, and which is good because I'm always fight Lincoln's corner, but that wasn't where I was coming from, actually. What I was trying to say was whether we were in Lincoln perhaps getting less of a share because of the impact on the poor roads in the rural areas. We don't have parish councils, we don't have town councils, we have a city council. And of course it's a county seat, and the county seat attracts a lot of tourism in, so we get a lot of outside traffic into Lincoln and out again. So I suppose what I was talking about, and it doesn't actually define Lincoln as one of the areas. My understanding is Lincoln is not just an area, it's a part of Lincolnshire, but it's not classed as just Lincoln City as an area. I'd like clarification on that, because I see the four areas as sort of north, east, south and west. And unless I'm wrong, Lincoln is part of North. It's not all of North, it's part of North. So therefore, that would be split perhaps between Lincoln, North Kesteven and West Lindsey. So I wasn't having to go at the rural areas, but obviously I made my point about, the urban areas tend to take more of a bashing than, and that goes for Grantham and Sleaford and Boston, etc., etc. So, I was talking about really all the urban side, but Lincoln specifically. And I do apologise to my colleagues if I've put your backs up. Thank you.
I've got a lot of sympathy as a Lincoln councillor for what you're saying, but if it's criteria-based, in one sense, it shouldn't matter too much, really, as to which division we're in, if it's criteria-based. Okay, sorry. Yeah, Councillor.
I was just going to come back on the points being made. We have a highways asset management plan, which has got hierarchical set out and for the different classes of roads, and that is the way the money for maintenance of highways is apportioned according to that plan. So the money should go to where it's needed most as you work your way down that hierarchy.
And it does, Rob, and that is why, because of the small rural roads, as Andrew said, that might have 6 cars or 10 lorries go down in a day, whereas, Mike's quite right, the asset management plan that goes to highways, which I think comes to full council as well, is the driver about what roads are repaired. So it isn't done on, like me saying I want my roads done, because I don't get them done. I'm with everybody else.
Councillor Keys.
Yeah, I was just going to come back as well. When I go to parish council meetings, I hear things like, oh, all the money goes to Lincoln on that bypass. And I say, well, fair enough, the bypass does cost a lot of money, but it benefits all of us, me included. It's transformed my working life, that bypass has. So I defend things like that in Lincoln. And I totally take the point that we don't want one against the other. But in the countryside and on these rural lanes, one of the things I've noticed is that farming has changed and it's become much more industrialised. And the little tractors and trailers that used to use these lanes, and perhaps horses and carts before that, have been replaced by massive machinery. And a lot of farm products are moved around the county to big storage and processing places, and these little roads with no foundations are just not good enough anymore, and that's made matters worse. So I defend the parish councils there who are struggling with this, whilst at the same time appreciating that the big Lincoln projects do benefit us all too. When someone says, I'm not paying my road tax because this pothole's not been done, I said, oh, well, you don't just drive up and down your road, do you? You go all over the county, perhaps. And perhaps people need to see it a little bit more like that. Thank you.
Richard.
Thank you, Chairman. I think the comments of this committee have probably just strengthened the reason why we put that 5 million into highways, I think. But that's not to say that every member of the executive doesn't fight for their area and their departments, because they certainly do for money and any underspends. Each department gets to keep part of their underspend anyway. I think it's 1%, isn't it, Trish? So there is some money there, but certainly with Councillor Baxter's comment about the green agenda, certainly one of the things I've been looking at since taking over is how we can get solar panels, PVs, heat recovery, all those sort of things into our buildings, and we are reviewing that at the moment. So with this campus being one of the main areas what we're looking at the moment, which will probably be quite a hot topic. We're not, well, we are very concerned. We're not aware of the great bill coming down the line with regards to electricity costs for the council, and we do have estimates of what that will be. So there's very much a focus on how we can upgrade our buildings, and with our new buildings, certainly something me and Councillor Bradwell are very keen on is getting the environmental aids and that into them buildings. So it's certainly something we are looking at.
Thanks for that, Richard. I like your comment about solar panels being a hot topic. It was pretty good. Yeah. Okay. Yeah. So, anybody else want to speak? No? Okay. Did you feel, Michelle, as though anything was left unanswered?
No, I was just going to reiterate what Councillor Boutroy said about the 1%. So the table lead does show which each director has got in terms of their 1%, and that's set out in the report as well. So they've got some flexibility there to deal with their own pressures. The Green Master Plan is an item on the Development Fund initiatives, and that's in the report as well. So there is some work being done on developing the plan and tool for that. So that is in that report as well.
Lovely. Thank you. Andrew, is there anything you want to add?
Well, I guess I was going to, if the opportunity arose, just to sort of give a bit of an update, because clearly the inflationary environment's been talked about in a few of the questions, and I know that obviously the Local Government Association conference is underway as we speak at the moment, and the Secretary of State for Local Government, Michael Gove, made some announcements this week, which might be quite helpful context for what comes next in terms of the future financial environment for the council. So, as I say, inflation's been mentioned throughout the meeting. You know, there's pay negotiations going on nationally at the moment that will be more expensive than what we put in the budget, so that sort of re-emphasises the need for contingency around inflation. Councillor Boucher has just referred to energy costs coming down the line, and they will impact on us like they will do householders when our relevant deals run out, but also as well things like the national living wage will have significant impacts upon our contracts, particularly in the adult care world as well. So there's a lot of volatility at the moment. Michelle referred to capital volatility, and that's something we're going to have to keep a very close eye on as we prepare the budget for 23-24. But yeah, just returning back to Michael Gove, he announced on Tuesday that the government will be consulting on a 2-year finance settlement for local government shortly, so we'll be keen to report back to various committees on what that looks like. There was a renewed comment around fairer funding, albeit that may still be a limited redistributional impact for councils, but again, given the size of our numbers, will have a sizable impact upon us. And there was a comment, but again, it depends how deeply interpreted that is, that there won't be particularly much more money beyond the obviously the assumed 2% increases in funding that were announced in the spending review last year. So quite a lot of volatility, quite a lot of uncertainty, as ever, as we've talked about before. But I just thought it was worth adding some colour to the debate that's been had around the room this morning. So thank you.
Sorry. Okay, so if there's no more contributions.
My leg's gone numb, so I'm just going to have a little walk. I'll be back.
Okay, thank you.
Thank you, Chairman. Around the fairer funding review, Andrew, and I know this is probably highly unlikely, do we actually have any fixed time frame on this? Because we've been promised this, as you'll know, dealing with it as the 151 officer for years and years and years, and then we were going to have it, and then COVID happened, so it's moved, and then it's moved again. It seemed to be being kicked down the can down the road, as it were, and we, as the second largest authority in terms of road by area, we kind of keep affording for that to happen. With the volatility as well, we're really in a perfect storm.
Yes, Michael Gove referred to calendar year about the review, so we'll see what that means and how that pans out. In terms of what we might get in this 2-year spending review, sorry, 2-year settlement period that he referred to, we know the big unanswered or the big unallocated pot of cash was the services grant that was announced at the last settlement, which I think nationally was just under about £800 million. So that might be what's in play for next year and the year after, but we shall see. And again, as facts become available, we'll share those with members in the right fora. So thank you.
And that period takes us up to the next county council elections and also the end of this parliament. Okay. Go to the actions required. We've considered the attached report. We're going to determine whether the board supports the recommendations the executive has set out in the report and agree any additional comments to be passed to the executive next week. So those in favour of supporting the recommendations to the executive. All those in favour? Any against? One abstention. Two abstentions, sorry. Apologies, Ashley. Thank you to both of you, Andrew and Michelle. So we move now to the next item on the agenda, which is procurement of the County Council telephony service, page 165. Okay, over to you, Lee.
Okay, thank you, Chairman. So the paper in front of you today is relating to the Council's telephony system and the progression of the procurement activity that's due to be presented to Executive in July. The procurement activity relates both to our contact centre platform and the telephony solutions that are used within our service areas, which support the work that people do in a much more flexible way now, both in terms of being able to take and manage calls whilst on premise and in individuals' homes or other locations. So I thought it'd be worth giving a bit of a setting a bit of a scene around the telephony work, so you can understand why we want to bring about the changes, and then obviously you can take questions on the report. The telephony improvements drive some of the ambitions of the customer strategy and the digital strategy, and they focus on how we use different technologies to improve service provision. And telephony is one of the key contact channels for the organisation, and we need to ensure that that is both stable and fit for the future. The telephony solution that we're looking at increases choice for customers. It gives new channels that customers can come through on. Enables us to more effectively manage social media interactions and enable customers to communicate with us through that, as well as improving the availability of automated technologies. So for some interactions, there is the ability to go through an automated process without having to come through to a contact centre agent, and the telephony system, the telephony platform can support that for us. For others, we recognise that there's still a need to talk to an individual. Some of our services are more subjective and quite emotive, and we need to be able to ensure that they are supported, customers are supported through to the right place. So what we have done is we've worked with colleagues across the organisation and with external partners to both evaluate the market position and to determine the specification for the county council. What we have seen is a dramatic shift in the technology over the last 2 years. So most of us have seen within our personal lives and indeed the way committees operate, a significant change in the way that people use technologies to communicate and interact. And it's important that our telephony technology and wider technology responds to that and enables us to develop in the future. We'll be moving on this proposal, moving the solution to be a cloud-based solution, which means that it continues to evolve and move forward and is easier for the organisation to support. And we also want to be able to connect this into wider technological initiatives. So the technology solution interacts with our Microsoft products, where we use Microsoft for a whole range of things. It will interact with Teams. It'll enable staff to make telephone calls from Teams rather than the standard Teams meetings and interactions we currently have. And it'll also give us enhanced performance reporting for the contact centre environment. So through market engagement, we saw a strong response from a number of suppliers. An evaluation of those responses has been completed, and that's led to the recommendations that are in front of you today. So we believe that the Anywhere 365 platform is the most appropriate platform for the County Council's needs. We've identified a preferred supplier to help move us from our existing Avaya contract and arrangements onto a new platform. And we believe that through the deployment of that new technology, we can both enhance service provision and we can deliver financial savings through drawing down from a more competitive marketplace. So that's led to the recommendations that are in front of you today, and hopefully that's given you a good summary of progress and activity.
Thank you, Lee. John, is there anything you want to say?
The only thing I would add is in terms of timing, why is now the right time to do this? And I think that is very much about the timing of the contracts around the contact centre, which are decisions that will be coming to the council, but we'll be re-procuring those operational services against a background where we've already optimised and reduced traffic and capacity, and lock in those savings over the duration of the next contract period. And you'll be unsurprised to know that we're also using it opportunistically to effect a transition away from ISDN, Integrated Service Digital Network, which has got a very modern sounding name. It's actually a very old technology that delivers voice calls. BT are switching that off nationally over the coming 18 months, and so actually we'll be killing a number of birds by affecting this change as well. So in terms of, if I can put it this way, the planets aligning somewhat, it seems perfect timing. This is these technologies have taken a step forward as we all now use Teams in ways that we would never have imagined we'd have used it pre-COVID. It has taken over our lives, and telephony just slides in underneath Teams for most of us, unless you work at a contact centre, in which case you have different interfaces.
Anybody want to raise any points, questions, give support? Yeah.
Thank you, Chairman. The only thing I'd mention, the use of AI or bots was mentioned. Certainly my personal experience, when I've seen them, you go to Vodafone or any other phone company, they try and use them. Now, unless the technology is approved in the last year or two, and it may have done, they are incredibly dim-witted. And when you're trying to go through something in the local authority, it's usually much more personal, much more stressful. An example I had before I was a county councillor, I had to renew my blue badge, which sounds very simple and straightforward until you try and find the contact details for the department to do it. It wasn't, because trying to find it within a sub-menu was actually quite difficult. But when I actually got to speak to somebody, problem solved, because I could speak to somebody, they say, oh no, you do this, or we can do this and this for you, problem done. So just be, if we are going to use AI or bots or things of that ilk, just be careful and, shall I say, sensitive in how they're used, because otherwise we could end up with egg on our face, quite literally, with a stack load of complaints because you can't find what you're looking for. And that's the last thing when you want to try and sort something with the council, because you're usually quite stressed or concerned because something's about to run out or you need to do something by a certain date. That's the last thing you really want to be dealing with.
Yeah, so completely understand the point and completely agree. The solutions can be incredibly frustrating if they're poorly designed. Simity are a leading provider of telephony platforms, and we'll work with them to gain their expertise on how to design and develop the solution. What we're not saying is that we'll put bot technology across the board. We don't believe that is the right thing to do. And the AI technology is broader than just chatting to something on a screen. So what it enables us to do is use things like natural language processing to enable people to ask for things and be directed straight through to the right place. So taking your example, conceptually you'd be able to ask for the blue badge team, and it would put you straight into that team rather than you navigating a myriad of menus that can be quite confusing. So we see it as an opportunity to move ahead and to modernise some of the interfaces that we have with the public, but we fully recognise the need to robustly test that. And within the deployment plans, we'll be looking at how we engage both with customers where appropriate, but also with elected members to test those concepts and ensure that they are appropriately designed and embedded.
Okay. Yes. Yeah, Councillor Keys.
Yeah, thank you. I'll just echo really what Councillor Smith said. Try and make it as less of an irritant as possible when you're doing these things, because a lot of the people who contact us are elderly and hate these automated systems with a vengeance. Press 1 for this, 2 for this, and 7 if you want to punch the person who invented the system in the first place. I just think we don't want to be increasing people's frustration. We want to be seen as an approachable authority, particularly for the vulnerable. And I also know of people who, like Councillor Smith, have had issues contacting us over various things. I do think you mentioned about if they mention blue badge, it puts them through. That sort of system, to me, seems a lot better than going through all these options and you go through all the sub-options and then realise you've pressed the wrong button and have to start all over again. So I think that's probably a good thing. But we do need to be aware of the people that contact us, and many are vulnerable and don't like even speaking on the phone, let alone going through all that. Thank you.
Very valuable point, and same with Tom's. Any comments about the simplicity, in building the simplicity into the scheme?
So the work John and I will be doing, subject to approval of the paper, is working with Simity to look at how we design the interface. So we recognise we have an interface that was designed at a certain point in time. It was modern when it came in. The press 1 for this, press 2 for that was a step forward from waiting for somebody to plug a cable in, wasn't it, at one point? So we want to understand what market leading organisations are doing in this space and how we better design that. What we also want to do is facilitate those that can to interact in a way that suits them, which takes some pressure off the contact centre and therefore enables us to provide better support to those that can't or need that additional assistance. So this is linked, as we said at the start, back into the customer strategy ambitions, which is about enabling those that are more digitally savvy to transact and interact in a way that suits them, but putting that wrap of care around those that need additional help. Now, our intention and ambition is to start with the with the lower complexity interactions. So again, to assure the committee, what we're not seeking to do is put high levels of automation into some of the social care settings as an example, because clearly that is more emotive, clearly that is more difficult to do. We will be starting with the more transactional areas, and we'll test that and we'll gain insight from how that is received, both from elected members and public feedback. and that will give us some assurance as we start to roll the system out. So what we expect is a deployment plan that moves us from the existing system to a new build that would take a number of months to do, and then an elongated period of kind of continued improvement and added functionality that enable us to test and learn and provide the support that you've set out.
Thank you. Could I just ask if we have to have tinny music, that you choose that carefully as well? Because that's the other thing that winds people up. Thank you.
Okay, point taken. Councillor Kendrick? Yep. Yep. Councillor Kendrick.
Thanks, Chairman. Can I just ask, in your testing, do you have a band of people you can use, a group of people who are not familiar with the system at all? I'm thinking of customer testing, as it were, so to make sure that it is accessible to people who have no experience of this sort of system. Because it's one thing for technicians to say, yeah, we've tried it out and it works, but for people, members of the public, basically, to be a customer testing, as it were. Do you build that into your testing system?
Yeah, so we've got a number of routes available to us. Some of that's still to be determined as we engage with the supplier. We have representatives, staff representatives across the council that we can use, that we can ask to test solutions. So we have individuals from every assistant director area that we would bring into this project. They're trained in looking at solutions from a customer focused perspective, and I would be asking them to test. We also have the Let's Talk engagement platform, and we have around about 1,000 people that are members of our engagement processes, again, where we can reach out to them and ask them to be involved as appropriate. Clearly what John and I need to do is determine the timelines and the type of testing that needs to be done through the supplier. They have a proven methodology for bringing this in and providing assurance, and we're due to meet with them over the coming weeks to understand that in more detail, and then we'll build additional bits around it. But John, I don't know if you want to add to that.
Yes, I happen to know also the contact centre are quite used to testing new processes that are customer facing, so the internal staff present a different dynamic, don't they? But the much more difficult problem is getting it right for citizens. So Serco actually, and the skills we have in the contact centre today, who will be part of this sort of migration to these new capabilities, establish sort of customer panels, and they invite people to sit down and give us a very raw opinion sometimes if we don't get it right, and that's as good as we can get, I think, in terms of what the average person, you know, how they react to the systems and things.
Okay, Eddie.
Yeah, sorry, can I just come back?
No,
Sorry.
It's all right. Yeah, I'd like to agree with Councillor Key, actually. So that's my first comment regarding the, you know, press 1, press 2, etc. Some of us will remember the 70s, where there was a program called Tomorrow's World. I remember seeing them in a telephone kiosk, and they actually had the person on a screen they were talking to, and I said, that'll never happen, you know. We've moved on so far now. Don't class all of us oldies as non-tech, you know. And I'm just thinking, as the generations move through, I mean, my granddaughter is already an expert on an iPad, and she's only 4, you know. So, I mean, the point I'm making, I suppose, those vulnerable people need to be protected and helped as much as possible. And there are a lot of people out there in Lincolnshire and beyond that are not tech savvy and don't understand these issues with technology. So they have to be helped. But yeah, I'm great. You're absolutely right, it drives me mad. You get right to the end of something, you know, and sometimes then you get cut off and you've just wasted 20 minutes and they cut you off, you know. That's the sort of thing that perhaps will happen everywhere. It's not, you know, that's life, I'm afraid. But yeah, I fully support the way you're working on this anyway, so thank you for that.
Did you want to come in again, Andrew?
Yeah, sorry, I'm sorry about that. I was just going to say to Lee, you mentioned a panel that is used to test these things. Is that the same people as are on the County Views panel? Is that the same thing?
Yeah, so we have, as John described, the panels through the contact centre. We have the staff panels that we can use, and we have the county views panel, which has around about 1,000 representatives on it. So each of those can be used in different ways to engage and to test solutions.
Thank you. I was just mentioning it because we've been pushing the county views panel I have at parish councils, and so this is another thing that you can say to them, that people are used from that panel when these new things come in, and that makes it more worthwhile to be on it. Thank you.
Thanks. Anybody else? I've got a question. Sorry, I've got a question. I'm not sure whether it's to yourself or maybe Andrew. But on the opening part of this report starts off by talking a long overdue stabilisation upgrade. Okay, this is of the old system of AIR, is in progress. Can you just explain why something, what seems important, was overdue, and not by any ordinary word, but by it was long overdue. So what period and what were the consequences and how did it happen? Okay, John.
Yes, we included that because anybody aware of the portfolio in IMT will be aware we've had this long-running program to upgrade the Avaya system. It's an upgrade much in the way that we patch systems, so it's just terminology. Patches tend to be smaller changes. Occasionally you have version changes, version upgrades. So they're all basically about keeping the software up to date and fit for purpose, generally under support with the original vendor. So the upgrade work to Avaya was of that ilk. So we weren't trying to achieve massive changes in its functionality or bring new features on. There were modest improvements. But it was about keeping that system available, and indeed it's been in a rather parlous condition for quite some period of time, and the project was as much about keeping it working and keeping it in a safe place as it was about affecting an upgrade that was fighting us every inch of the way. It was to do with technical complexity, it was to do with the number of organisations involved, it was to do with the fact that many organisations used the telephone system originally, district councils and so forth. Some of those things have simplified, others are just complexities that have been overcome. But I thought it'd be disingenuous not to sort of explain the fact that whilst it is telephony, it's not particularly related to the future world, it was about sort of the maintenance of existing estate.
Okay, I'll go along with some of what you've said about not connected to the current system, but you know, if the word is long delayed, like a train is long delayed, then there are consequences. And I just wonder why it was long delayed, why was it long overdue, and what would we have been able to do better earlier if it hadn't have been a delay?
There's no simple answer to that, but the list of issues in that project goes back over 2 or 3 years. So, and they are in the dozens. And as I say, some of those were constraints placed on us by external organisations, the inability to do things, and a number of stakeholders from other organisations. That sort of fixed itself as SKDC in particular withdrew from the system last year. Some of it was about challenges we had with Vodafone, who in turn subcontracted the work to an Avaya reseller. So we had a long chain of suppliers that just existed by virtue of the way the contract was originally procured. That added complications. And you've heard me use this answer before because I somewhat inherited the project in a pretty difficult place. And when asked, how do large programs like this go wrong? The truth is really one day at a time. You never really have this obvious blinding moment where, it's time to change course or whatever. But it was evaluated perpetually during the course of the project. Are there other options available to us? It had a crazy high risk profile. And at no time was it really safe to do anything other than keep it safe, keep it serviced, and trying to complete this upgrade. And we stuck to our guns. It is almost done, ironically. But that should have no bearing on your thinking in terms of what should we do for this next generation of technology and delivering our digital strategy.
Thank you. It may not have any bearing on the new system, but I would still like an explanation as to why, from an overview and scrutiny point of view, things didn't happen promptly. The other point, and you can perhaps clarify this because I think it's simple, is that the stabilisation seemed to have been necessary in order for us to do the transfer to another system. Because if the top of page 169 talks about provided the LCC the time to evaluate its future telephony options, make a decision and implement the solution for LCC in readiness for the end of the Serco contract, it should be noted that despite the upgrade to the higher platform, it is dated and does not have the functionality. So why couldn't we be going to another supplier much earlier without having to upgrade the system?
More latterly, certainly over the last 18 months, it became obvious that there was massive disruption in the communications market. And indeed, this was a direct result of COVID. So
in what way?
The organisations providing these services were faced with an audience that were no longer using their corporate telephones, but were using Zoom and Teams and so on and so forth. And that also seemed to inspire organisations who previously had taken no interest in telephony, suddenly moving on that market. Microsoft had shown no interest in voice traffic until 18 months ago. Amazon were showing an interest, but very specific parts of the market. So new services became available that really built on that reality that now communication is essentially a network service. It's an IT service, much like any other IT service. So that gave us exciting options that you could achieve some of the functionality in different ways, but this synergy with the ecosystem that we use in Office 365 and Microsoft Azure simply wasn't possible as recently as 12 months ago.
Okay. Anybody else got any comments? Any thoughts? Andrew? No? Okay. So we go back to the recommendation. Consider the attached report and determine whether the board supports the recommendations the executive has set out in the report. We'll have a vote on that. And the second point is agree any additional comments. Well, there's been a few from different councillors that were reported to the executive. Okay, so those in favour of supporting the recommendations of the executive are set out in the report. Those against? Any abstentions? No, carried. Thank you. So the final item is just to look briefly, if we want to, which is for information only, on OSMB work programme for the rest of the year. That's it, just for noting. So thank you for your attendance. Thanks for everybody's contributions. Thank you.